morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning. It is Monday, June the 29th.
It is Monday, June the 29th.
How about that? Week 15?
We just finished 15.
Did we?
Uh-huh.
Oh.
We're in 16 now.
Are we? Wow.
You know what I do every Saturday morning.
I know. That's what you do. I know. Wow.
Trust
Week
the expert.
16.
I know.
Here we are.
I know.
Okay.
Wow.
Yeah. But we're back.
We are
and
back.
We appreciate
but
everyone being
still
with us. And we are on our new schedule, which will be twice a week, Mondays and Thursdays
Yes.
at 9 a.m. live on Facebook and YouTube, and again every afternoon at 5:06 on the radio, and of course on KNMI radio at noon, Mondays and Thursdays.
Yes.
And so we're still going to be providing local information, talking to local guests, sharing local info about what's happening as things reopen, stall from reopening, pause on reopening.
That's right.
All those things, because
right.
it really, it's the virus that is determining all this stuff.
Yes. No executive decision-making function in the virus, but,
Yeah.
we respond to it.
It really drives a lot of these other decisions.
It's tough.
That we are seeing, and across our state and across our region.
That's right.
Because we're seeing other stuff from our neighboring states, and they're having a tougher time of it.
They
than,
are.
New Mexico is.
They are. It should be noted that they don't have a wear a mask policy, like an official wear a mask policy. There's a
Statewide.
soft statewide,
Right.
but not a, like we have a,
Right.
requirement.
Exactly.
They just have a strong suggestion.
Correct. And have left it up to the local, maybe some local jurisdictions
Some
too.
local jurisdictions,
so
yep.
There's that as well.
So-
Anyways, so we can start by looking at some numbers, right? And
Okay.
so I have the state numbers and the local numbers ready to go, but you have the national numbers
I
from
do.
Johns Hopkins, as you always have
As I always
at the
do.
ready.
I do. Okay, so as of Sunday night, 2,548,992 cases of COVID-19 have been reported in the United States alone, which is an increase of 38,655 from yesterday. One of those major hotspots, of course, was Florida.
Right.
They had almost 10,000 cases in one day.
Yikes.
And 125,803 deaths have been attributed to the virus, an increase of 264 from yesterday. The mortality rate has dropped, and they think it's related to, now we're testing more, so that shifts the stats, of course, so 4.9%. And of the 30,988,013 tests conducted in the U.S., which is an increase of over 500,000 since yesterday, 8.2% have come back positive.
Okay. There you go.
There you go.
So that's the national numbers.
Right.
So
Still
that's
climbing.
what we can see, correct. And then locally, here are the numbers from ksje.com. And again, we have compiled these from the State Health Department and other stories that are related to COVID-19. But as of yesterday, there were 192 new cases in New Mexico for a total now above 11,809. San Juan County saw 34 additional cases yesterday for its total now of 2,392. There was one additional death in our state yesterday for a total of 492, but that wasn't in San Juan County, so our deaths remains at 159, and there were 13 additional recoveries, so that number is now at 5,264. So those are the statewide numbers, and then as we scroll down, we can see a couple other signs and stories that I wanted to point out. Again, there's the daily statistics. You can click on that for more details. The Navajo Nation totaling 55 new cases yesterday, so their total is now 7,469 with one additional death. And then, of course, the other story that we have been following is the positive cases at the San Juan County Detention Center, and they released information that had 66 additional cases in inmates and detainees at the detention center, and one additional staff member for a total of 67. And so those numbers were included in some of the weekend numbers we saw released for San Juan County.
Yeah,
obviously.
and we also want to point out again, of course, of the 98 detainees who are positive, 97 are asymptomatic.
Right, which is interesting.
Important.
Exactly. And
Just to further the point, you might not know you're sick.
right,
Yes.
which is why you should wear a mask.
Correct.
Is what we're saying and what the state is saying to everyone. As we scroll down a little bit, there was one other story I wanted to mention, which was here at San Juan College, that one of our instructors had tested positive for COVID-19 and is now isolating at home in quarantine. And the college had implemented all of its practices about contact tracing and talking to all the people and students that may have been in contact with this instructor, and so that was released again on Friday. It's on our website, as well as some of the other stories that I think is important to note. So there's that. We will continue to scroll around on the website, and I can show you a little bit about the state dashboard here in just a second as that loads up.
Okay.
And see how the state's doing nationwide or statewide, not nationwide. You just did the nationwide.
How is the
numbers.
state doing nationwide?
Yes.
Well, I mean, hey, we haven't pulled up that New York Times graph in a while about
We have not.
where
That's
we
true.
land on all of that. But I don't even know if they're keeping up with that anymore. So
Last time I checked, they were, but that was another week or so ago. So
while you do that, you want to hear an
Hard to say.
interesting fact about roadkill? It relates.
wow, that's quite the transition. But
Yeah,
okay,
exactly.
All right, audience. On your behalf, I will bite and say yes.
Yeah,
Yes,
I mean,
do.
it totally relates. So UC Davis in
If you're
California.
having breakfast, I'm so sorry. Go ahead.
Unless it's marmot. Good news for marmots. Hey, I went hiking this weekend, and I saw 2 marmots.
Oh,
And I restrained myself from desiring to cook them up.
good.
I'm just kidding. One of them was
Okay.
a big old guy. Anyway.
Anywho.
So,
Yeah.
okay, so
All right.
UC Davis in California has a road ecology department, which is pretty cool. I don't think I ever put 2 and 2
Of course
together.
they do. Of course
I know.
they do.
Well, and then I was like, I want to join because
Right.
I love road trips. That's also a very American thing, right? That we like to go on road trips, particularly this time of the year.
Sure.
Summertime
All right.
road trip.
Traditional, yeah.
4 million miles of road in the United States.
Okay.
If you were to travel all of it, that's enough to cover the Earth 160 times, like to go around the globe.
Wow.
So anyway, but each year there's about 1 billion, with a B, billion animal deaths attributed to like roadkill.
Sure.
So now
It's just going to
that
happen.
it totally happens, and we whatever, it's an accident. Hopefully, most of the time,
Yes.
it's an accident when we do it. But
course.
so they UC Davis researched 3 states since the coronavirus happened.
Yes.
So there's less driving.
I'm on your every word.
Yes.
I'm just waiting to get to the
So the point is, 100,000 deaths have been prevented.
prevented.
Yes.
Oh, okay.
So not driving equals.
So we're
of
going to
course,
be
less.
overrun with deer and what else gets hit by cars, is what you're saying.
No, well, I mean, because we have an extinction crisis, you know.
Not of deer. I don't
No,
think.
or
No.
stray cats.
Yeah, or rabbits.
Not that but that's not how we want them to
Okay, no,
go.
of course not. But okay.
So anyway, 100,000 animal lives have been saved since the coronavirus.
This has been scientifically proven.
That's right. So, you know, I think what's interesting about that, besides the whole, like, that's just interesting and kind of a, you know, an interesting story, but also it's all of these unexpected tributaries of data
Interesting.
that come out because of
Okay.
this.
Well, all right.
So, there
Thank you
go.
for sharing. Apparently, you've missed a llama story on the Today Show.
Shut up.
So you'll have to
really
go do
keeping-
some homework on
Oh,
that.
my goodness. And I'm
But
supposed to
thank
be
you
the
for
llama
sharing,
person.
everyone.
I'll have that for you tomorrow, listeners.
Stay tuned.
Or Thursday.
Thursday.
Because we've switched this schedule.
We have. I know.
I might post it on the Facebooks.
Okay. All right. We do have a caller.
Okay, cool.
So we'll take a little break from this.
Okay. Well, that was it. That's all I wanted to say about roadkill.
Okay. Well, it's quite enough, actually. So thank you. But that's okay.
Cool.
That was interesting.
Again, tributaries
in
of
a
data.
COVID kind of way.
In a COVID world, we have less animal deaths.
Yes. So there you go. There's a little silver lining, I guess,
Mm-hmm.
to this. Let's go to the phones. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott. Good morning, Megan. This is Dr. Underwood from over at San Juan Regional. How are you this morning?
Dr. Bob Underwood, we are well. Thank you for calling in. It's great to have you with us. You are the Chief Medical Officer at San Juan Regional Medical Center, and so we appreciate you calling in to give us kind of an update on the conditions at the hospital and how things are going. What can you tell us as we start this week?
So, first, I want to say thanks for having us on. You know, thanks for the support. Megan, I want to know more about marmots in UC Davis now.
See? Yes.
So,
Thank you.
Yeah. So things are going well and still trending okay as of Friday. Of course, we're analyzing the data from over the weekend, transfers, et cetera, for the region and for the state. But overall, today we have 25 patients that are currently in our hospital that are COVID positive. We have 7 of them in our COVID intensive care unit, and 4 of them are on ventilators right now. So that's we're still seeing that, but we're Also, transferring patients in. Our trend a couple of weeks ago was to send to Albuquerque, but we have accepted a number of patients from Friday until today that have actually come here from smaller outlying facilities to ours, which is good. That keeps folks that are here in the region closer to home, and they're closer to their family and closer to their social network. So I think that that's a really good thing. If we look at the state overall in terms of the R effective, I know we've all heard that term in terms of how many people get infected. On average, one person infected passes it on to how many more. And we have the best rate in the state right now of 0.97, which is good because as long as that number is less than 1, we would say that the pandemic is under control. And we're at 0.97 right now, or at least as of Friday morning.
That is good news, Dr. Edward. I hate to interrupt you, but I mean, just for so long, we were pointed out as one of the worst performing areas of the state. So I think that's worthy of a little pause to kind of let that number sink in a little bit.
Absolutely. And it comes from doing the right things, wearing the mask, social distancing, of course. We've talked about that a bunch. We want to go out and we want to support businesses that are in our community, but we want to do it in a safe and effective way. So that number was 0.97 as of Friday. You mentioned the detention center. Those numbers being large might skew that number, but we'll be paying close attention to that here, of course.
Great, interesting. And so as we roll into, trying to go back to our adapted normal lives, I would say, what what kind of things, as far as summer activities go, would you think are in kind of in a safer category or in the clear? So, for example, if you have a small summer camp and the kids are socially distanced, what's the take on that? Or we have restaurants opening up. Where's the risk there? We have hikes outside. Like what activities would you deem safer than others?
Sure. In general, those things where you can maintain those precautions that we already know work are best. So hiking, obviously, that's good. Mountain biking, the kind of outdoors things that we do around here in the Four Corners area are significantly safer overall. Dining, if you can maintain distances, I know that there's restrictions on dining establishments in terms of how many people that they can have in. Of course, you're not going to be wearing a mask when you're eating. So if you can be dining in an outdoor setting, that's probably better. Wind helps disperse the virus if there are people who are exhaling the virus, so that would be beneficial as well. Other types of outdoor activity, if you're going to be in close contact with other people, naturally wear your mask. Over this coming weekend, I'll be up in the mountains looking for marmots, of course, Megan. And those are the safer types of activity if you're outdoor in an area where you're going to be widespread and dispersed. 4th of July weekend, of course, lots of people want to be outdoors. I would refrain from congregating into large groups. Nonetheless, the ability to be outdoors is usually considered somewhat safer.
There you go. And I think following a lot of these COVID-safe practices that the state has been promoting and talking about, no matter what activity that you are doing, it sounds like a lot of these are the same refrain a little bit about the keeping your distance and wearing a mask and maybe being outside more than being inside, washing your hands, not touching your face, hunting for marmots, whatever the case may be. All these things are...
That is the word of the show today.
I think it is. Yeah. I think it is. But it sounds like, Dr. Underwood, and all these different maybe activities that we might want to do with our families or friends or whomever, following these existing guidelines is probably a good rule of thumb.
Absolutely. Those are the things that are proving out to be of benefit. So, again, not to, like you said, it's the same refrain, but wearing a mask. Wearing the mask, I wear a mask to protect you. You wear a mask to protect others around you and to protect me. And to try to remember it in those circumstances really is the big benefit. This is not a political debate. It's just science. Is droplets are blocked by the mask, not 100%. Nonetheless, it does decrease the amount of spread, and therefore it is a benefit for people around you when you are wearing a mask. One of the things that we've discovered around here is that a lot of people have masks that have an exhale valve on them, so you're exhaling unfiltered air. So we're not allowing that among our employees here at the hospital, the caregivers that come in, to wear a mask that has an exhale vent on it, because it decreases the effectiveness of that mask.
That makes sense. So I have a two-part question. One is, when it comes to crowds, what is the suggested number that you don't go over? Obviously, the least amount of people that are around you, the better. But if you had like a cap for that, what would you say? And then the second is, as far as treatment at the hospital, because we've heard a lot about different treatments that the hospital is using. Is there any update on that specifically?
So, interesting question, and yes, two parts. So there's not really a standard answer for the very first one, because it depends on where you are. If you're going to be indoors, crowds of more than 10, you don't want to have that. And it depends on how close together you are as well. But if you're going to be outdoors and you can disperse more than 6 feet apart and you're wearing a mask, then the size of the crowd is less of an issue, as long as you're maintaining your appropriate separation. That's the part that it takes a little bit of discipline among individuals to try to make sure that you're maintaining all of those precautions. At the hospital, you asked about treatment protocols. Remdesivir is still so remdesivir is an antiviral medication that works similar to the way Tamiflu would. So it's trying to stop the viral replication, and we are using that and have supplies that came basically from the federal government through the Department of Health, and then the Department of Health dispersed it to organizations that had a higher census, if you will, of number of patients. And so we have a supply of remdesivir. We're still using that on our patients here. The hydroxychloroquine, we have discontinued that from our standard protocol, as it was proving not to be beneficial to the patients. We have used as well some convalescent plasma in more severe cases. And those seem to be the standards in which we're following right now. Of course, everybody is waiting for a vaccine, and when will a vaccine be available? I've likened the work going into trying to develop a vaccine for COVID-19 to the moonshot. If you think about all of the resources that are going into this, and certainly it's not getting as much press as going to the moon did back in the 1960s, but if we're able to develop a vaccine by next year, that would be so unprecedented scientifically, biologically, physiologically, immunologically, that it would be the biological and medical equivalent to going to the moon.
Amazing. And of course, there's a lot of resources, a lot of research being done on that vaccine. I can't recall exactly how many trials I've heard are going on right now with maybe different types of vaccines, Dr. Underwood, but I'm sure you've probably read in some of your research and medical journals that there's concurrent testing and trials and things like that to see which vaccine is going to be the one that moves forward in this case, right?
Right, and yes, there's a number of vaccines and a number of vaccines that are targeted at different parts of the virus in terms of how do you neutralize its effect. So a number of trials are ongoing. Some animal trials are currently, and my understanding also is that there's some very preliminary human trials that have started. And again, we're not going to see anything from this that, again, it's not about developing a vaccine. It's about developing a safe and effective vaccine. And the safe and the effective part are really what takes a lot of time in order to show statistically, biologically, immunologically, that this works and will not cause harm.
True. Very good point. And Dr. Underwood, I just had one more question for you, and that is, as we have seen with some of the spread of the virus, as we've already talked about, following these COVID-safe practices are the best ways that we know of today to reduce our chance of being infected. Some of the articles that I happened to read over the weekend was about maybe if you are just in passing with somebody, you have less of a risk of maybe getting infected than you are if you're sitting with someone or around someone for an extended period of time. Is that anything that you are hearing as well about the length of time that you are with another perhaps exposed individual, that if it's a greater length of time, you may have a greater risk of getting infected?
That is correct. And so you look at it in terms of duration and intensity. So if you're around somebody who is shedding virus, you have to, we don't know what this number is, we don't know what the volume is, but generally one viral particle won't contaminate somebody. Several will. And so the question is how much of that exposure do you have to have? And the longer you're around somebody and the more intense the contact with that person, then the more of that viral load that you're going to take on and thus increase your risk of actually conferring the disease. Does that make sense? I'm trying to parse it out. It's not just a passing, like you said. So if you're, I'm trying to think of somebody that if you're in close proximity physically with someone. In fact, we give our instructions to our caregivers that during an examination, if you're having the interview part of the examination, to wear your mask and be separated and only be in contact with the patient for the parts of the examination where you must be. And once you're done with that part, then separate back to your 6-foot range again, because we're trying to decrease the duration and the intensity of that contact.
No, it makes sense. It does very much. So very good. Thank you, Dr. Underwood, for answering the question and giving us some good information. We appreciate it very, very much.
Always happy to be on, Scott and Megan. Thank you very much.
Wonderful. Thank you. And again, extend our great thanks to you and your colleagues at the hospital. We appreciate the work that you all are doing for our community.
Yes, sir.
Thank you very much.
Thank you.
Dr. Robert Underwood, he is the Chief Medical Officer, San Juan Regional Medical Center, joining us on our COVID-19 local information program this morning.
Love him.
Yeah. Apparently he's a fan of marmots. Who knew?
I know.
Right?
I like
Look
that
what
he
you've
was,
done.
I know, he was just going with that joke.
Yeah.
Super fun.
There you are.
I know, our docs are super fun, aren't they?
They are.
Good sports.
They definitely
Good sports to put up with us.
Well, anyone has to be a good sport to put up with us.
That's true. Looks like we have somebody else that's willing to put up with us on the phone.
We do, and hopefully it's our next guest,
I
right?
think so, yep.
And so we had talked a little bit about, maybe talking about some other industries and businesses as they reopen, or businesses that have stayed open with having to change the way they do things. And so one of those businesses was grocery stores.
Of course.
And so let me introduce our next guest. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning. Thanks for having me.
You bet. This is Jason Chappell, yes?
Yes, sir.
All right.
Enough, but
Very good. Thank you. Jason, you are with Smith's Grocery.
yes, sir.
Assistant
Yes, sir.
manager.
I am one of them, sir. Yes.
One of the assistant
For the
managers.
yes, for
Okay.
the e-commerce department. So.
Gotcha. Well, thank you for joining us. And so, again, and Megan, this was one of your contacts.
That's true.
So thank you for reaching out to Jason to get him on the show and talk a little bit about grocery stores.
That's right. That's right. So first, we want to hear about e-commerce, because I think that some of the charges for that stuff have changed. But also, I'm just interested in general, what the best practices are now. I know that the grocery store has had to make some adjustments, and so it might be helpful for people to hear about that.
Yeah. Well, e-commerce for a grocery store is a little bit different than e-commerce through like Amazon. For us, you place an order through, our website, and then we have a team of, right now it's a team of about 25 people that pick that order. It could be, one person picking it or two people. Because of the whole COVID thing, we've been trying to limit the amount of people picking your groceries. So that team will go through the store based on the items that you picked and are selected through the website, go through and shop that order for you as best as we can. Because of supply issues and stuff like that, there are opportunities to do substitutions. So when available, when the customer allows us, we try to do substitutions for that. So that's pretty much what we do in a nutshell here at the store. So.
Got it. Okay. But that's been a really big, popular service with all this, hasn't it? the curbside pickup and things like that?
You know what? It really has. I mean, when we first, pre-COVID, everything we were doing about 40 to 50 orders a day. Now with COVID, in the middle of it, we've shot up to 110 a day. I think a couple days ago we spiked at like 120. So it's definitely been a big boom for business, this whole situation that we're in.
Yeah, I have noticed that as well. That's pretty mind blowing to think about that many people coming in. But anyway,
right. Yeah. Well, and a lot of people taking advantage of this service too, to just go and pick up their food at the curb, and not have to go into the store. I took advantage of it before COVID, and now even more so. But so what kinds of changes did Smith's make when this sort of disaster began? What kind of extra cleanliness, extra sanitizing has gone on?
We for the first few, I'd say probably about the first month and a half of it, we had limited our hours. That way we could focus on deep cleaning shelves and deep cleaning shopping carts and all surfaces that are possibly touched by customers. We are still in the process of doing that, even if with our expanded hours going back to normal. We're still in the process of doing, being very clean about what we do. We're still sanitizing carts, every single day. We're still cleaning shelves. We're cleaning our restrooms nearly hourly. So yeah, we're doing what we did before, but we're just amping it up just to ensure that, we're keeping as many people safe as possible.
Very good. And I know at your store and other stores, I would imagine, with the new kind of practices by the state of having limited capacity, and you're having to keep account almost of how many customers you have inside the building at any given time. And
yes, sir.
You've adopted a mask policy for your employees and requests for your customers. Is that true too?
Yes, that is true. We've all associates should be wearing masks with the exception of being on break or, on their lunchtime. But, we try to strive to ensure that everybody is as safe as they can when they enter our store.
Very good. Well, and that's important too. And I know that's not just a Smith's thing; that is a grocery thing throughout the industry. I would imagine. Yep. So
yeah, from what I've seen from my colleagues at other stores, throughout the country, it seems to be a generalized practice. Everyone wants to ensure that employees are staying safe, but also customers are staying safe. So,
right. And I know some of the earlier items that maybe were not in great supply. We've seen runs on the famous toilet paper, paper towels, and things like that. Have the supply chains kind of calmed down and then caught up with the demand? Or is that what you're seeing in the store as well? Or are there still some shortages from time to time?
I'm not going to say we've completely caught up, because we're still having shortfalls on cleaning supplies and stuff like that, but we are getting them more frequently than we were. Toilet paper hasn't been an issue, thankfully, for the last few weeks. But yeah, cleaning supplies, that's one thing, because I'm not sure what the manufacturing process is on it, but obviously they have to meet certain standards for it to go out for consumption. Not consumption, but for use by everyday people. So
right, and you had limited the store, not necessarily you personally, but the store had limited items and numbers of items that you could buy at any given time. Are there any restrictions on anything these days, or are some of these things still in limited supply? So you do have to limit how much of a quantity a customer could purchase.
Certain items like sanitizers are still in limited supply. However, because we're getting ample supplies of other sanitizers, so to speak, we're not so much limiting anymore. I mean, if we see that an item is obviously in a hot commodity, and everyone's wanting it, we're definitely going to try to address that. But as of right now, we have no limits in place.
Gotcha. Very good. And I know, again, a lot of folks wearing masks. Some folks may be wearing gloves when they go out shopping, and we've heard different things about the effectiveness of gloves if you're shopping for things and touching multiple items in your same pair of gloves that you're wearing. Not always maybe a good idea. Do you have any advice or guidance on that, Jason?
Just work smart. Just be smart about it. I mean, try to keep yourself educated on the different things that are being released from different organizations. So that's my only advice.
Okay.
Great. So I have one more question to close us down, and that is, what is the coolest mask you've seen?
Oh gosh, you know what? I'm a bit of a geek, sort of like you, Megan, and I've seen a couple, like geek themed masks. I've seen a couple Star Trek ones and Star Wars, and those are fun because they're just, to me, they make me smile. They they bring me back down to earth and say, okay, we're in this right now, but things are going to get better in time. So just try to have a positive outlook on it.
Yes, I feel the same. Particularly the Star, and Scott also joins us in the Star Trek love.
Oh, yeah.
What?
Yeah.
No way.
Yes.
Scott,
Yeah.
I love you now, sir.
Okay.
I love you now, sir.
Okay.
Yeah, we could all nerd out.
Appreciate
Get
it.
all Trekkie. So anyway, yeah, so Jason, thank you so much for calling in. We love to hear about how you guys are doing because speaking of frontline workers, grocery store workers have been.
They've been there
Since
since
day
the
one.
beginning. That's right. Very true. So thank you very much. Thanks for calling in, and stay safe.
Yeah, thank you guys, and I appreciate the time to talk to you.
You bet. You bet. Thank you very much. Bye-bye now. That's Jason Chappell. He is one of the assistant managers at Smith's Food and Drug here in Farmington. So appreciate him calling in.
We do. So
Yeah.
I've been using the curbside thing since the beginning.
Have you?
Oh,
See,
yeah.
I still go in. I still like to pick out my stuff.
I don't know.
I don't know what it is about.
Yeah, I would. Well, see, because I don't like walking through the aisles and stuff. I've never liked grocery store shopping, so I'd like put in a podcast and stuff. But then I feel bad.
You're one of
'cause-
those people.
Yeah, but then you couldn't hear.
No,
on
right.
occasion it got me into trouble.
'Cause I would usually be the person behind you with a cart
Yeah.
saying, excuse
Excuse me. Excuse me.
Yeah, and you're not paying attention.
Could you pause your Economist podcast
Hit
for a
your-
second?
Yeah, trying to hit your shin or something
Ooh,
to get
wow.
around you. Oh, I'm sorry.
Aggressive
Well,
with the cards. Jeez.
Anywho, yeah.
Okay.
So there's that.
New
Yeah.
side of Scott.
Right. Nerdy and aggressive.
I'm Scott Micklin.
There you go. I did want to show.
What?
Did want to show.
It's your
the
fault.
Other, I know.
You walked
Believe
into
me,
that.
I know. Believe me, I know. Again, this is the dashboard from the state of New
Yes,
Mexico.
yes.
We were talking about the numbers at the beginning of the show, and so we can kind of wrap up the show with numbers again.
That's right.
As we take a look at San Juan County, as we click on this, there it is. It flips around on the screen there. As we go to the county, and again, we can see the numbers and the breakdown. Maybe harder to see, but again, the gender breakdown, it's pretty evenly 50-50.
Yes.
And
That's
then-
nice.
Yeah.
Gender equality with the virus.
There you go. Thank you. In San
No
Juan
glass
County.
ceiling here.
Not at the virus in San Juan County. That's true. But I thought it was interesting of what Dr. Underwood was saying about how our infection rate, right, is the lowest
That's
now
right.
in the state for all the regions.
0.9.
Yeah,
Less
than
than
one.
I don't know how that. I should have asked him to explain how that works.
Well, if you've watched some of the, I know you have watched some of the briefings, right, from the state and Dr. Scrace and the
Right.
others, if it's one or less than one, that means maybe that we're just infecting ourselves, right? If
Right.
it's above one, we are infecting maybe more than ourselves, and that's
Right.
the issue, I believe. So if you can keep it at one or below one, you have it more under control. And if I'm wrong, someone will probably point that out, but that's okay.
Live on Facebook.
Live on Facebook, and so we understand.
Can you scroll down so I can see the age breakdown?
Yeah, no. Maybe
Okay.
I can. Well, this was pre-recorded, so I don't know what I did. There I did.
There I did.
There, I did it. So,
Well, I'm
scroll
just
down.
looking because
Right.
that's the new information we have rolling in.
The biggest bar on that graph, which you can kind of see, is certainly not the older
No.
population.
Yeah.
I guess that's the point. Even if you can't see the numbers of the ages,
20 to 30.
we can still, thank you, we can still see that it's not the oldest population.
Right.
So our most at risk are not the ones that are maybe having the virus.
Correct. So that this is pertinent because younger folks tend to think that they're more invincible.
Yeah.
And so they're the ones frequenting the bars, frequenting the restaurants, the nightlife, all of that jazz. And they tend to be asymptomatic or mild as far as the way the virus affects them, although that's
True.
not a guaranteed. But
Right.
so again,
Good.
just a word of caution.
Exactly. No, good to point out. And again, we're seeing that, and we're seeing it in our neighboring states.
Correct.
And so that's a concern. So we will keep an eye on it.
That's right.
Definitely. So very good. Anything else about marmots you want to share today on the show?
I feel like the roadkill bit was a good bit. I try to add in
it was interesting.
Yeah, I try to add an
appreciate
interesting bit each show.
I know.
Personal algorithm sends me those.
We appreciate being able to, glean information from your well-readedness.
Exactly.
Yeah.
I'm a nerd, a geek.
Well, we appreciate that. So there you go. All right, everybody. I think we're going to call it a show.
Yes.
For a Monday.
That's right.
Now we'll be back on Thursday with an
yeah.
update from the earlier parts of the week when we're not with you every day. And we hope you'll join us on Mondays and Thursdays as we move forward here on our local information program for COVID-19. But stay safe, everyone. Wash your hands and don't touch your face. And we'll see you on Thursday at 9. Bye-bye.